Continuing on with our programming is another member of the PQA team. Patrick Campbell is PQA's Senior Director of Research. Patrick will explain PQA's interest in SDOH, describe our projects underway, and level set us all on SDOH factors that we will rank later this afternoon. Patrick?
Hello, everyone. It's my pleasure to join you today to discuss PQA's focus on social determinants of health, which I will refer to as SDOH moving forward, and highlight some of our SDOH-related work. My name is Patrick Campbell, PQA's Senior Director of Research. So why are social determinants of health a focus for PQA as an organization focused on medication use quality? Well, the answer is quite simple. In addition to the traditional domains of healthcare, addressing the complex circumstances in which individuals are born and live is important to advancing medication use quality and helping individuals achieve positive health outcomes. Additionally, understanding the complex interplay between SDOH and health outcomes through foundational public health and health services research can inform initiatives that aim to improve medication access and quality. As many of you know, PQA has developed a number of medication adherence quality measures. But adherence only captures a small fraction of the medication use picture, as it only tells us whether a person was able to successfully pick up a medication. We do not know anything about the upstream encounters that may affect a person's ability to gain access to those medications. Several healthcare access and utilization conceptual frameworks have been created and used for decades to identify and target gaps in care. However, none of the frameworks focused exclusively on medication access and its associated barriers. So, in partnership with the National Pharmaceutical Council, PQA set out to develop that framework. We convened a multi-stakeholder roundtable of experts from across the healthcare continuum, including health plans, community pharmacies, government agencies, professional organizations, research groups, as well as representatives from the patient community, so that they can help develop a framework specific to medication access. The group leveraged 2 scoping reviews and an environmental scan to identify medication access barriers, interventions impacting medication access, and existing medication access quality measures. The group also made consensus-based recommendations for future work, which is available in the Access to Care report, which is available on our website. The roundtable developed the Medication Access Patient Journey conceptual framework. It is designed to provide a more holistic view of medication access. As seen here on the slide, the framework includes 7 nodes that represent the various stages a patient encounters while gaining access to medications. It starts with perceived need, goes through help seeking, encounters with prescribers, receiving prescriptions and having them processed by the pharmacy, dispensing and counseling of those medications, and finally, adherence to those therapies. Its cyclic nature conveys that barriers and challenges occurring upstream of adherence can have significant impacts on medication access. The Access to Care report also contains predominant barriers patients might face, including health system, provider, and patient-level SDOH variables that are mapped at each node. As you can see, barriers like cost, health literacy, transportation, and insurance coverage can influence multiple access nodes. And these barriers represent opportunities for targeted intervention. It should be noted, these barriers are not an exhaustive list, but they do help identify key barriers that should be considered when designing interventions to improve access. Since the release of the Access to Care report, PQA and the National Pharmaceutical Council released a request for proposals for research projects that address access barriers to medications. 2 projects were selected, and we are excited to collaborate with the University of Rhode Island to evaluate the impact of patient out-of-pocket costs for oral anti-cancer medications on medication adherence, and work with researchers at the Johns Hopkins University to assess the impact of a real-time prescription benefit tool on access to medications. We are actively working on these projects and look forward to sharing findings during our 2021 annual meeting. A project that PQA recently completed, in collaboration with Liberty Software and VUCA Health, found that prescription medication educational videos increased medication access. For this study, we focused on primary medication nonadherence, also known as PMN. PMN is a subset of medication nonadherence and focuses on the initiation of new prescriptions. PMN occurs when a new prescription is prescribed, but the patient is not able to pick it up within an acceptable timeframe or provided with a therapeutic alternative. For this study, we compared pharmacy PMN rates across a group of pharmacies that offer medication educational videos to a group of pharmacies that did not provide the service. The videos were sent via text message or email to patients when the pharmacy received a prescription electronically by a prescriber. The medication videos represent a health literacy conscious intervention to improve medication knowledge by providing patients with the most important information regarding the newly prescribed therapies. Topics include potential side effects, indications, proper administration, as well as expected benefits of the treatment. Videos average 2 minutes in length and have a 5th to 6th grade reading level. This study highlights the importance and the impact of targeted interventions that can overcome specific barriers to medication access. Like the PMN study, there are other initiatives that have been completed or are underway to overcome access barriers and address SDOH to improve healthcare for all Americans. And pharmacists are serving as a critical member of the healthcare team to accomplish this goal, since pharmacists can see the patient's struggles first. As one of the most accessible healthcare providers in the US, pharmacists know their patients. However, access to pharmacies may be different across different communities. In the absence of formal pharmacy access designations, there is heterogeneity in pharmacy access definitions in the literature. We know that influential spatial factors like time travel, distance to a pharmacy, or pharmacy to population ratios are important. But there's also non-spatial factors like race, income, insurance coverage, and as well as transportation access that must be considered when defining pharmacy accessibility. Although these variables have been identified, they have not been validated. So, in partnership with the University of Arizona, PQA is developing a conceptual model defining pharmacy accessibility and describing levels of access in metropolitan areas with significant history of racial segregation. These findings can help support future population health initiatives to improve pharmacy access for all Americans. Another area of focus for PQA relates to the landscape of SDOH data availability. We know data plays a critical role in the business and delivery of healthcare, especially within value-based frameworks where reimbursements are tied to health outcomes. Yet, we know very little about how these social determinants data are collected, shared, and used. And understanding the structural and organizational mechanisms that healthcare stakeholders leverage, as well as the challenges that they face in collecting and using SDOH data, will advance our collective ability to meaningfully capture these data and address barriers so all people can have high quality care. To shed light on this important area, PQA has partnered with the Texas Center for Health Outcomes Research and Education to administer a multi-stakeholder survey to answer these important questions. These findings will help inform future directions for pilots and demonstration projects, highlighting best practices, and developing standardized tools and resources for pharmacists to collaborate with other members of the healthcare team to effectively address SDOH. So it may not come as a surprise, but SDOH is a PQA strategic initiative moving into 2021. One of our goals is to create a resource guide that will detail the SDOH interventions most likely to improve medication use quality and where pharmacists are best positioned to provide screening, referrals, and interventions. This summit is where that work on that guide begins. We have identified 7 factors or action items that are likely to be featured in an initial resource guide. And we want your collective wisdom and experiences to inform how they are prioritized. These 7 SDOH issues were described in the brief pre-read document that we distributed to all summit attendees. I will review them here in advance of the polling exercise you will participate in at 2 p.m. today. As we go, share your comments and your questions in the box on the screen. We'll evaluate some of those comments in the next session, and we'll take all of your input into account as we move forward developing this resource guide. So let's review those 7 factors now. Screening for SDOH identifies and documents patients' unmet social needs, which affect medication access, adherence, and outcomes. As trusted and accessible providers embedded in the community, pharmacists are pivotal partners for screening and follow-on SDOH services. The cost of medications is a barrier to obtaining needed medicines for many Americans. However, there are many ways to address the direct out-of-pocket medication costs and help patients access low-cost or even free medications, including co-payment assistance and formulary modifications. Patients come from diverse cultural backgrounds that may influence their understanding of health and illness, interactions with healthcare providers and institutions, and engagement with treatment recommendations. Pharmacists can impact care through reduction in cultural and health literacy barriers, through needs assessments, education, and health coaching. Individuals without reliable access to affordable and nutritious foods are more likely to be non-adherent to medications. Pharmacists can help patients access food assistance programs and recommend pharmacotherapeutic options where the effect is not dependent on foods. Decent, safe, and affordable housing is central to good health, effective care, and positive health outcomes. Pharmacists can play a role in screening for housing issues and referring at-risk and vulnerable individuals to housing support services. Loneliness or social isolation is one of the most common SDOH issues reported by patients. The high frequency of pharmacy patient encounters, including telehealth expansions, represents an opportunity to better identify loneliness, improve social support networks, and provide resource referrals. Limited Physical mobility and the inability to get to a pharmacy to obtain prescriptions is a major challenge that many patients face. Affordable, reliable public transportation, rideshare partnerships, and other non-emergency medical transportation options can help address these barriers that stand between patients and their needed medications. These are some of the issues that we're starting with. We look forward to your feedback, including whether there are other major SDOH factors that we should be prioritizing at this time. After a quick word from our sponsors, Lauren Kirk, our Director of Stakeholder Engagement, will chat with the panel of PQA members about these factors, and we'll share some of the comments that you've submitted today. Thank you again for being a part of PQA Leadership Summit.